Hello, everybody. Thank you so much for having me. Red is not in my color wheel, so I wear pink. So that's my color, but I see some familiar faces. Good to see you guys. Thank you so much for having me. So as a cardiologist, I'm actually at the 39th Springhill Cardiology Clinic on 39th Avenue. And one of my favorite things about cardiology is the fact that we can help people manage their cardiac problems or prevent cardiac problems from happening to live a longer, more full, healthier life. So it's my goal to talk about these kinds of things with you today, and I look forward to your questions at the end. So just a little outline. The first thing is we're going to talk about some cardiovascular conditions and how common they are, because it's important to know, hey, let's prevent this, but also what in the world are we preventing? So we're going to jump into that first. We'll talk about some risk factors, which means that things that put you at risk for or give you a higher chance of having heart disease. And there's some out there that you may not know of that we're continuing to discover that we'll discuss as well. And then some healthy habits too. So it's important that we talk about what are things, you know, you guys are very proactive. You're coming here to this wonderful talk. I see lots of fruit on the table, which hats off. But what are the things that you can do to continue to be healthy and live a long and very full life? So heart disease, or we call it cardiovascular disease, is very, very common. So 49% of the population in the United States of people over the age of 20 have some form of heart disease. That could be high blood pressure, coronary heart disease, heart failure, stroke, all those things together. And the high majority of that is high blood pressure or hypertension. If you take that part away, still in patients or people over the age of 20 in the United States, almost 10% of people have heart disease, and women almost as much as men. So it's a very prevalent thing that we want to address and prevent as much as possible. Unfortunately, it's also a big cause of mortality. So it's the leading cause of death in the United States. And there's a cardiovascular death every 34 seconds. That's not just a heart attack, that's actually dying from a heart problem. And then in 2023, looking at that deeper, 1 in 3 deaths was from cardiovascular disease, about 33%, but 1 in 6 of those were from patients younger than the age of 65. So it's not just a disease for older gentlemen, it can involve many different kinds of people and young people as well. So I want to bring attention to that too. So the first condition I'll talk about is hypertension or high blood pressure, and this is the most common thing across the board. And what happens is there's these blood vessels that bring, or tubes, that bring blood away from the heart to the body to give good oxygen and nutrients. And as you can see here, this healthy one has nice thin blood vessel wall, but the one next to it with high blood pressure, it gets stiff and narrow and causes the pressure inside the heart to go up. Unfortunately, this is most often known as the silent killer because patients don't have symptoms. Occasionally you can have headaches or lightheadedness with high blood pressure, but this is one of the reasons why it's so important to see a primary care doctor, come to things like this, get your blood pressure checked. If you go to Publix or CVS, they have those blood pressure checks everywhere. Just take a peek and see how your blood pressure is doing, because most people don't have symptoms when the blood pressure is high. And this is the leading risk factor for many cardiovascular conditions. Next up, so I'm going to say this is going to be our number one risk factors. So hypertension is number 1, and then hypercholesterolemia or high cholesterol is also number 1. So they're both super important to take care of, and you'll hear about it a lot during the talk. So high cholesterol is when there's cholesterol that's floating around in the bloodstream and it can stick to the blood vessel walls and cause plaque formation. Again, this is one of those asymptomatic things, so it's really important to see your primary care, get your labs at least once a year to check and see how you're doing. For the two that are the major players, there's LDL or low density lipoprotein. We call it the bad or the lousy cholesterol, and then triglycerides. And both of them together and isolated can really increase cardiac risk. So those are what we're going to talk about more as we go too. So there will be a test on this at the end. Just kidding. This is the only really sciencey slide that I will include. So what this is looking at the blood vessel wall. So this white space up here is the blood vessel. You can't see the blood, but the blood's moving through over here. These little gold balls over here in the top left corner is cholesterol, so the LDL cholesterol. That low density lipoprotein can easily slide through the blood vessel wall. And right here, all this business over here is the blood vessel wall. So the cholesterol slides into the wall and the body recognizes, hey, this is a foreign object, it should not be in here. So the body, being smart as it is, it sends your immune system to attack this foreign thing that's in the blood vessel wall. So you can see these blood vessels or blood cells We call them monocytes, but it's the immune system coming in to gobble up and try to get rid of all these cholesterol levels, which is great. But when that happens, the process of it is it creates this solid plaque that forms. So what happens are the immune system gobbles up cholesterol, but then it becomes this like thickened, calcified area. And that's how plaque forms in the heart arteries. So the only reason I bring this up is because it shows how cholesterol can be dangerous, but also the immune system or inflammation is a huge player in this as well. So those are two things to kind of remember: inflammation and high cholesterol. So kind of moving into the actual heart conditions. So we know that high cholesterol, high blood pressure are issues, number one and number one. But what happens? So one of the most common forms of heart disease we see is a heart attack. So it's called that because what happens is there's a sudden stoppage of the blood flow in the heart artery. That soft plaque from cholesterol builds up, and all of a sudden, out of nowhere, it breaks off, stops the blood flow, and patients have severe chest pain, severe shortness of breath. Sometimes the symptoms are left neck and arm pain as well. Occasionally it's actually back pain or even indigestion or feeling like GERD, reflux type symptoms. So everyone has a little bit of a different symptom. But if you ever wake up or you're doing something and all of a sudden you have this severe chest pressure, severe shortness of breath, that's a medical emergency and you want to go to the hospital as quickly as possible to see if you are having a heart attack. Another kind of chronic form of this is the chronic coronary disease. So what happens is, this is a CT scan of the chest. Again, my last really sciencey slide, but you can see these little spaghetti noodles right here. This is the heart muscle kind of cut in half. This is the muscle itself. This is the blood on the inside. And this is the blood flow to the heart because like any organ, there needs to be blood supply to give it oxygen and nutrients. And if you see here, these little tiny white flecks right there are plaque that forms. And like we talked about from the initial slide, cholesterol builds up in the blood vessel walls, the immune system comes and gobbles it up, and as that forms over time, more plaque can form. A little bit here and there is no big deal, but as it forms over and over and over again, it can cause narrowing and blockages in the heart arteries. So the symptoms with this are a little bit different. It's not like an all of a sudden thing. It's a slowly over time. You do activity, you notice you get a little bit shorter breath. You rest, it gets better. You do activity, you notice that you get a little chest pressure, you stop and rest and it gets better. So this is one of those things that you can see when you're normally used to walking a mile a day, no problem, and then all of a sudden you're like, man, halfway through I can't catch my breath. This is something we want to evaluate for and make sure that the heart isn't the cause of it. And then my last of the cardiovascular conditions I want to talk about is a stroke, which can be so debilitating. So it's really important to understand what we can do to prevent it, but also if it were to happen, be very proactive about getting it taken care of right away. So there's two versions of stroke. There's ischemic stroke and there's hemorrhagic stroke. The ischemic stroke is more what I'll talk about, where it's kind of like a heart attack. We call it actually a brain attack sometimes because it helps people to realize how severe it is when it happens. So what happens is a small fleck of plaque breaks off into the brain artery and stops the blood flow to the brain, which obviously is extremely necessary. The hemorrhagic stroke is whenever there's a bleed inside the brain that's very sudden. So that's more of kind of a neurosurgical emergency if that were to happen. The symptoms that you can see with stroke, and what's so cool is they have this like fast acronym to remind you of what to look for. So if you're with a friend and all of a sudden they're acting weird and you're like, something may be wrong, you need to look at these important things. So one is facial drooping. So have them smile. If one side of the face doesn't go up, then that's a sign that, hey, they could be having a stroke. You also look for arm weakness. So you have them hold the arm out, and if they can't hold one up or if there's any difficulty with that, they may be a sign that they could be having a stroke. Also looking at speech. So hold up something really easy, like, a bottle of water, what is this? And if they can't tell you, and they normally can, then hey, something could be going on. So if that happens, you want to call 911. Because the treatment for this, just like for a heart attack, is very time sensitive, so you want to be able to get to the emergency room right away. The cool thing is at UF, they started this about a year, maybe 2 years ago. They actually have a mobile stroke unit with a CT scanner inside this thing. I don't know how they did it, but it's pretty amazing. So they'll be able to come to the house if there's a concern for stroke, pick you up, and then actually give you that clot-busting medicine that treats it immediately if it were to happen. So, but let's talk about ways we can avoid this kind of stuff. So, the first thing is risk factors for heart disease. There are some traditional risk factors that are very commonly known. So number one is smoking. Smoking is a huge risk factor for heart disease. High blood pressure and high cholesterol, number one. We'll talk about again more. And then diabetes and obesity or being overweight are also very known traditional risk factors for heart disease. It's important though because there are actually some risk enhancing factors. So there's other things that play a big part in increased risk for patients. If you have a few of these smaller ones and add them up, it still increases the risk tremendously. So we'll dive into this a little bit deeper too. So as we know, high triglycerides, high cholesterol, number one. And then there's this thing called metabolic syndrome, where they kind of just put a name on it, where there's sort of a lack of metabolism of cholesterol and things like that, where patients have a few different factors that sort of increase their risk altogether. So they have to have either high blood pressure, higher blood sugar, abdominal obesity, high triglycerides, and then low HDL or good cholesterol. And having 3 of those 5 is kind of a risk factor in itself to increase the risk of heart issues. Chronic kidney disease is also a risk-enhancing factor. So people, forget about this sometimes. But what happens is having chronic kidney disease is a very inflammatory process, which again, like we learned from that sciencey slide, is that inflammation can definitely add to plaque formation, stiffening of the heart arteries, high blood pressure, and cause concern for increased risk of heart issues. Another condition that may not be known is those inflammatory conditions. So rheumatoid arthritis, psoriasis, HIV/AIDS, even inflammatory bowel issues, all of those amp up the inflammation in the body, and that increases the risk of heart problems. So you want to make sure these are controlled, but it's a good thing to tell your cardiologist or your primary care doctor as well, so they can know and better control those too. And then one of the biggest ones, I feel like this is probably the biggest one that we see, is having a premature family history of heart disease. So if you have a first-degree relative, so a parent, a sibling, a kid even, who has a history of a heart attack or a stroke at a young age, for men that's 55 or less, for women that's 65 or less, that's a huge increased risk factor for your heart problems. And so it's important to let your provider know so we can do a little bit more digging to see if there's other causes for those issues. Also the history of preeclampsia or early menopause. So when I see women in clinic who are coming for just kind of a cardiac evaluation, I actually ask about, hey, were there any issues with delivery with the babies or any problems, even if they're in their 70s, because it still plays into the risk of heart issues. So we want to make sure and tease all those things out. High risk ethnicity, so South Asian ancestry is actually even set aside as one of those higher risk ones. So we want to ask about those kind of things. And then peripheral arterial disease, which means that there's like a blockage or lower blood flow to the arms or legs. If that's found, then there's a pretty high risk that there's actually the heart arteries are involved too. So it's one of those things that we want to play into our evaluation as well. So this is the best part. So we know it can be bad. We know it can be sad. We know it's very prevalent. What are things that we can do to prevent patients, you, me, from having heart disease in the long run? What's incredible is Life's Essential 8. So the American Heart Association came out with a campaign to really help raise awareness of the things that we can do on a day-to-day basis that can really help reduce your risk of heart attack, stroke, or other cardiac events. So we'll go into each of these in detail, but I think this is really the most important thing. And I'll give you a slide at the end to show you the website, but it's nice because there's a ton of good patient information on the website. So if you have one specific question about one thing or another, you can always dive a little bit deeper into those and look into those too. So number one, so eat better. You guys hear that a lot, I'm sure, and you hear a lot of what not to eat, which is great, but the most important thing is what do you eat? So it's so important to fuel your body, being active, exercising, doing normal day-to-day. You want to fuel your body with good things like the oranges and bananas and apples I see on the table. But number one, you really want to eat lots and lots of fruits and vegetables. That should be definitely the mainstay of your diet on a day-to-day basis. You want to do more whole grain food, so less like starchy, white bread, that kind of thing. You want to do oatmeal, whole grain breads, things like that, because they have so much more nutrients that come along with them. And then healthy protein sources. So plant-based protein is really one of the best ones because you get so much of the good protein source with the less inflammatory, better foods for you without some of the fat and cholesterol with it too. But again, I'm not saying meat or anything is bad. You just want to do more veggies if you can. So plants, legumes, nuts, beans. Broccoli is actually really high in protein. You can even just Google high protein vegetables, and there's a ton of different options that are there. Fish and seafood are good as well. There's different ones that have a little bit more, less cholesterol content, more nutrition benefit, like salmon is very beneficial. So I'd recommend looking at that too. And then if you do eat some dairy, trying to do more low or fat-free dairy because that has less cholesterol in it, but you still get that calcium, you get those kind of things. I see your yogurts out there as well. And then trying to do minimal lean and not processed meats. So I would avoid Deli meats, hot dogs, those are very processed. They're highly sodium heavy. Some that came out recently, they actually are a carcinogen now too, so you don't want, that just increases the risk of cancer. So you want to minimize that kind of stuff and do more like baked, grilled chicken, fish, that sort of a thing. And then one thing I'll plug into about the veggies and the fruits and vegetables is that there's this thing called Eat the Rainbow, and it's a campaign to help increase the knowledge of how there are actually a lot of benefits from different vegetables and fruits, and that's healing benefits, that's symptom benefits like helping digestion, things like that. So I definitely encourage you guys to look into that too, because those are all good things to see how we can really help to not only just fuel our body with energy, but in good positive ways. So other things as far as eating. So you want to eat more unsaturated fats. So olive oil, avocado oil, cooking in those things as opposed to like butter, lard, even coconut oil, because those are broken down in a different way that really increases the cholesterol levels. So one kind of thing to think about is if an oil is actually solid at room temperature, it's definitely a saturated fat and you want to avoid it. So you want to do more of those liquid ones. And those are both things that really play a big factor into cholesterol levels. You want to do minimally processed foods. There's a bunch of junk in food, especially stuff that's been processed and preserved and on the shelf for a long time. You want to try to avoid those and do more of those like whole food, plant-based, make in your own kitchen versus things that are off the shelf in the freezer section, that sort of a thing. Those are much more healthy for you as well. And then little to no salt. So I don't actually check my salt content, but for those who do or those who have high blood pressure, I think it's something to at least kind of just look at the labels at one point and sort of get an idea of how much sodium are you bringing in. The recommended amount is less than 2,300 milligrams of sodium a day, ideally less than 1,500. But I think just trying to be conscientious about avoiding processed foods, not salting your food, using other kinds of herbs and things like that for seasoning makes a big difference. So I have a big shout out for Mrs. Dash. I'm still waiting for them to sponsor me. They have not yet. But I tell everybody about it. So it's a great seasoning that has no salt in it, but it has good herbs and it has good taste and everything. I feel bad. I told the patient about Mrs. Dash and she got the Sam's Club size of one flavor. And at one point she said, "Can you please recommend something else? I'm so tired of eating this." Well, they actually have like 6 or 12 flavors. So please look into the different ones too. That's a great way to add some good flavor without adding more sodium to your diet. And then minimal alcohol. So trying to drink less than or equal to only 1 alcoholic beverage a day is actually beneficial for your heart too. So that plays into it as well. Okay, so funny story, I actually looked this up for you guys yesterday, and I love stuffed peppers. I kind of forgot about them. I haven't had them in a while. So my husband is the chef. So I texted him and I said, "Hey, can we have stuffed peppers tonight?" So we're having stuffed peppers tonight at my house. But this is the recipes from the AHA website. The American Heart Association has a great website. And sometimes it get a little bit bogged down of like, hey, I'm tired of eating chicken and broccoli and rice. I want something different. But they have some great recipes that are pretty easy and just good options that you can even start with or play off of to look at some good ideas that can be good protein sources that are, tasty and healthy for you too. And then this is my only slide on what not to eat because you guys already know these things and you've been drilled into you, I'm sure. So basically anything you would buy at a Gator football game is what you don't want to eat. So fried, sweets, baked goods, highly processed stuff, candy, sugary beverages, like all that kind of stuff you want to avoid. Not that you can't ever eat it, but just want to be as minimal as possible. Not an everyday thing, just more of a small treat here and there. And then we'll jump into some of the activity recommendations. So activity is such an important part of cardiovascular health. Whenever you increase your heart rate, you increase the blood supply places, you allow for more oxygen to be delivered, and then it gives your body so many positive benefits, including reducing the resistance of your blood vessels and lowering your blood pressure. And there's so many things that are positive about it. I think sometimes we can be bogged down because they say, do this, and you're like, well, I can't do that, so you kind of give up, which is fine. But the nice thing is there actually has been a study where for patients who do any activity, something every day, the mortality benefit is tremendously better than those who don't do any activity. So even if it starts out with 4 or 5 minutes a day of walking to your mailbox and back, I highly encourage you to do some activity every day. But let's jump into the actual AHA recommendations. So they recommend 150 minutes of moderate exercise per week. So that's about 30 minutes 5 times a week is what I tell my patients. It's about a 5 to 6 out of 10 for an effort ability. So you're trying to work yourself a little bit, but you're not pushing it as hard as possible. Walking your dog probably doesn't count if they stop to go to the bathroom or sniff something every 5 minutes. I do say that too. But a good way to kind of gauge how you're doing is to do what's called the talk test. So you can talk in full sentences with your friend you're walking with or doing activities with, but you can't sing. So if you can't sing, that's a good sign of, okay, your heart rate's getting up, you're working yourself a little bit more. And then for vigorous intensity, this is when you're really pushing it. So the recommended amount of this is not in addition to the moderate, but it's just either or. So you can do a mix of even both. So if you do 75 minutes of vigorous or strenuous activity per week, then that counts as like your activity recommendation from the AHA for the week. And that's about 7 to 8 out of 10 of your effort ability. So you're really pushing, you're not going as hard as humanly possible, but you're pushing it pretty hard. And the way to test this out is to do, for the talk test, you definitely can't sing because you're really trying, but you can only get a few words out at a time. That's a sign that you're really pushing yourself and getting your heart rate up and working your heart well. But these are kind of some good gauges to see how much exercise you're doing. And then for the activity benefits, you guys all know this as well, but there's so many benefits, short-term and long-term. So in the short term, it reduces anxiety, it reduces your blood pressure, it improves your sleep, it improves your cognitive function, and it actually even improves your insulin sensitivity, even in short-term exercise. So it makes a big difference. And then for the long term, it improves your cardiorespiratory fitness overall. It increases your muscular strength. It actually reduces depression, and it also creates a sustained lower blood pressure. So over time, it helps to lower your blood pressure. So if during the break you guys are out there walking laps around the Hilton, I'll understand why. So let's talk a little bit about tobacco. I think that public health has done a really good job of recognizing how tobacco is very bad for your health. You know, doctors used to smoke in hospitals a long time ago, but thankfully it doesn't happen at all anymore. But there's so many benefits of stopping, and it really is like the number one thing. If someone is smoking, I say, hey, quitting is the best thing that you can do for your health. But many benefits happen, so it reduces the risk of heart disease, diabetes, cancer, all sorts of things. Reduces actually depression and anxiety as well. And then it does slow premature aging. So if you are smoking, your aging, accelerates, and they've shown that from pictures of twins who smoked, who didn't smoke, and you can even tell a difference in like their faces. So making a plan for quitting, it's not easy. I think it's very important to know it is not an easy thing to do, but it is really important. And ways that can help are setting a quit date, saying, okay, I'm going to quit at X day, and that will help. Getting a plan in place beforehand makes it so much better as well. Some people can just quit cold turkey, and that's the best way to do it. But if that's more difficult, then doing like a slow wean can be helpful. So I tell patients, if you smoke half a pack a day, which is 10 cigarettes, then starting at a week, you only allow yourself 9 cigarettes a day for a week. And the next week, you allow yourself 8 cigarettes a day for a week. And you go down slowly until you're done smoking altogether. And they say it helps, or sometimes they get down to 4 or 5 cigarettes, but 4 cigarettes is a lot different than 20 or 10 on a day. So it does make a difference. So we try to encourage trying to do as minimal as possible. And there are so many resources out there. I recommend that if you know someone or if you smoke yourself, to use resources to help you quit smoking. So it helps with the cravings and the triggers. There's medications that your primary care doctor can give that really help with that. There's also patches and gum and things of that sort. And then Tobacco Free Florida is in Florida. And it's in every single county, and it's a free program that helps to encourage you to quit smoking. So they have group classes, they'll text you, they have all sorts of interactive things that help. They also find what are your triggers and then give you recommendations for what can you do instead. So it's a great program that really helps to target patients who smoke and how we can quit doing it. So that's the website there, but I definitely encourage if you know someone, or if you're smoking yourself, to look at it and see. If you get signed up, they actually give you free patches too, which is nice. Additionally, so next on our Life's Essential 8 is getting healthy sleep. And this is one of the things I think is forgotten and not addressed near as much as it needs to be. So adults should be getting about 7 to 9 hours of sleep per night, which is really beneficial for your health. There's multiple benefits, so improving brain function, mood, and energy. It actually improves your immune system. Your body heals while you're sleeping, which is incredible. And it repairs tissues, blood vessels, and there's less risk of chronic disease and obesity. So there's a really important thing why good sleep is important. I do want to give a little plug too for anyone who is concerned to maybe some sleep apnea. This is a very underdiagnosed, very prevalent condition where patients actually stop breathing at night, and it causes increased risk of high blood pressure, obesity, heart attacks, strokes. It's a very, very significant risk factor. I think that kind of hides behind the weeds sometimes. So what happens is, from our little schematic here, this is the normal airway, and this is the one that has issues. So what happens is when the person sleeps, their tissues kind of drop off and block off the back of their neck. And you hear like friends and family say, oh man, you snore so bad. Sometimes you wake up with headaches, or you wake up and you just feel really sleepy during the day. Those are all clues that you could have sleep apnea. It's important to see your doctor and be screened for that. It's amazing because we can actually treat it with a mask now that helps with increasing the airflow so the airway doesn't close. But they also have even an implanted device that they can put in and that will open your airway while you're asleep. So there's treatment for it, but the risks are so high with it. I think most people that have it get treated, they feel better on a day-to-day basis, plus their cardiac risk is improved too. So one of those things to, if you know anybody or if you feel like you may have it, it's good to talk to your doctor. And then so a healthy weight. So it's one of those things that has been, there's so much stigma about weight, you know, for the years and years and years, but it is important and it does reduce cardiac risk to be in like a healthy weight range. We measure it from a medical standpoint as like the body mass index. So it's the kilograms per meter squared. And yes, there can be times where there's a high BMI, but someone who's more healthy, like a big bodybuilder, it doesn't really work for them. But most of my patients who are over the age of 60, it seems to be a pretty good measure for them. So a healthy BMI is around 25 kilograms per meter squared. If it's over 30, it's considered obese, and there's classes that go up from there too. But I just want to note that they did actually see mortality with a really abnormal BMI, really high and really low. So underweight and overweight can both be issues for increased mortality. Benefits of weight loss. So for patients who are obese, if you lose weight, you improve your blood pressure, lowers cholesterol, improves quality of life and mobility in so many different ways. And it actually reduces cardiovascular events, urinary incontinence, fatty liver, and mortality. And there's a whole other host of names too. And I feel like as we see patients who are, a lot of them on these GLP-1s, these new Ozempic, those kind of medications, we see a weight loss and a sudden drop in a lot of things, like kidney disease improves, blood pressure medications actually can be taken away because their blood pressure gets so much better. So weight loss for patients who are obese is definitely one of those things that you want to consider for your own self. So back to number one, our cholesterol. There's different types of cholesterol. So there is good cholesterol. That's always a good thing. So it's called the HDL, or high density lipoprotein. What it does is it takes the cholesterol away from the body to the liver to be destroyed. So that's a good thing that we like. It does increase with exercise. So if you look at your levels and your HDL is low, then trying to increase exercise, increase mobility helps to helps to improve the level. Bad cholesterol, as we talked about before, the little gold balls, the LDL, low density lipoprotein, those are increased with red meat, pork, fried food, fatty food. That really increases the LDL. So trying to avoid those, doing more plant-based type items, doing more lean protein, those all help lower your LDL cholesterol. And then triglycerides are like these globs of free fatty acids that float around in the blood, and they increase with sweets and carbohydrates. They're actually extremely diet sensitive. So sweet tea, sugar, sweets, those kind of things all increase the levels. If you have a fasting blood test, but the night before you have a cheeseburger and a milkshake from Steak and Shake, your triglycerides may be high in the morning. So they're very diet sensitive, and it's great to try to reduce those as well. So controlling the cholesterol, I'm just going to give you these numbers because I think it's important to know that we do have specific goals for patients and their cholesterol levels to help get them to a spot that reduces their risk as much as possible. So for primary prevention, meaning you haven't had a heart attack or a stroke in the past, we like that LDL level to be less than 100. And then triglycerides, kind of across the board for all three of them, we like those to be less than 150. So that's kind of a good goal to have for those. If you have a history of a heart attack or stroke, or if you're high risk, say your dad died of an MI or heart attack in his 40s, we want your cholesterol actually even lower. So we want that LDL to be less than 70. And then for patients who are very high risk, have had multiple cardiac events, a heart attack, a stent in the leg, all sorts of cardiovascular issues, we try to get that cholesterol low, 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 because that also helps too. And in those cases, we get it down to less than 55. And then for blood sugar, so I won't go into this because diabetes is a whole day of talks worth of information, but it's still one of the things to keep in mind. This is wrong, but for pre-diabetes, just like your sugars are a little bit high and they're not off the charts, but they're a little bit elevated. So we look at the fasting glucose, which is looking at your blood sugar from like that specific point in time, which changes a lot during the day. But the A1C level is more of kind of like an average of 3 months of what your glucose levels have been. So that's kind of a good marker to see. It's supposed to be an A1C of 5.7 to 6.4 is pre-diabetes. I apologize for the error. And then for diabetes, where there is increased glucose and insulin resistance, meaning that your insulin, which is what helps get rid of the sugar so it's not floating around in the blood, is just not working like it's supposed to. For diabetes, the A1C level is over 6.5. So this is a huge player into heart disease. So as you see, this isn't how it looks, but these little sugar cubes floating around in your bloodstream with diabetes are very pro-inflammatory. And as we learned from our sciencey slide, that whenever there's increased inflammation, there's increased plaque formation, and diabetes is a huge player in that. So we control the sugar by everything is kind of the same, but increased exercise, healthy diet, trying to minimize those carbs, doing lots of good veggies, things like that, and then medication if necessary. And the nice thing is there's a whole host of toolbox of medications for diabetes that can be helpful. And then the last one of our Life's Essential 8, number one, is managing blood pressure. So they did a recent study that really the optimal blood pressure is less than 120/80, which is a little tough at times. And you always want to be wary of dropping it down too low and causing lightheadedness and poor symptoms. So I'm in my office, I'm a little bit more flexible with that rigid guideline. But we do, for the most part, want it to be less than 130/80. It does make a difference for cardiovascular risk. There's different stages of high blood pressure or hypertension. So if it's over 130/80 or 130/90, it's stage 1, over 140/90, it's stage 2, and severe is over 180/100. And it's tough. Sometimes you can do everything right. You eat right, you exercise, you avoid salt, all those things, and your blood pressure is still high. And for that, you can thank your parents, because usually it's genetics when that happens. But regardless of the cause of it, it's still important to control, because as you know, it's the #1 risk factor for all of these cardiovascular disease issues. So ways to reduce blood pressure, again, same things, which is nice. You do, the 8 and you knock out all these things in a row. So exercising, low salt diet, weight loss. What's neat is even 5% of weight loss actually will lower your blood pressure. So if you're 180 pounds and you lose 9 pounds, you'll see a reduction in blood pressure. And I think nothing makes patients happier than coming to see me and let's take away the medication, you don't need it anymore. So that's always a good thing. Reducing alcohol intake. So even drinking like 1 or 2 drinks a night consistently and your blood pressure is high, if you stop drinking alcohol, it will get better. And then if you do have sleep apnea, trying to treat it. So again, with that sleep apnea, if you fall asleep and if your airway closes, you get low oxygen to your brain, to your heart, to your lungs, and your body responds by increasing your blood pressure and everything. So if that gets treated, that can actually also lower the blood pressure too. So I want to give you the website for the AHA, the American Heart Association. I really enjoyed looking at it when I was pulling this up for you guys, because there's so much great information and recipes and all sorts of stuff. But it's called heart.org, so it's pretty easy to remember. But I highly encourage that if you have any specific questions or you want to dive in a little bit deeper on research or anything, definitely look it up, because it's a great website. Okay.